Happy Sunday. Happy Sunday, everybody. I'm coming on live today to do some health topics as promised, and I'll wait a few minutes for everyone to join. I didn't think I was going to make it. I'm on call this weekend and just got paged with a patient call. Hey there. Hi, Lindsay. But thankfully it was a quick call, so here I am. All right, we're going to give a couple minutes, maybe a minute or two, just for people to join in. And as you're listening to my video, please feel free to ask questions. I'm still a little new to the live streaming, so I may not see it. If I don't answer it, go ahead and throw it in there again, and I'll try to get to it. Hi, Alicia. Hey. Welcome, everybody. Where is everybody? Home relaxing, out enjoying the weather. I'm glad that we haven't been having as many rainstorms, but I'm sure it's coming again soon. Hi. How are you? How are the girls? They're always so cute and growing up so fast. All right, I'm going to give just a few more seconds and we'll get started. If you guys know anyone that's interested in this topic, go ahead and tag them, share this video, and I'm going to cover a few different things. And again, if you have any questions or have anyone that you know that would be interested, you can always share it at the end as well, okay? All right, well, I'm going to go ahead and get started. As you know, I'm Dr. Andrea. I am your board-certified pediatrician. I enjoy helping and empowering expectant, stay-at-home parents, working parents with the skills and knowledge they need to raise healthy, happy children and to help them to help their child achieve their developmental best. And today I'm actually going to be talking about a topic that I get asked about a lot in the office, which is infant congestion or newborn congestion. A lot of people worry over this. They have questions, they stay up at night, they call the office, and they actually, when they even know it's something that's normal for their child, they worry about how to treat it or how to make their baby more comfortable. So we'll go over those things today. So let's start with the number one cause. Well, not the number one cause, but a common cause, which is actually that babies have very narrow nasal passages. So if you can imagine, when you breathe through your mouth, if you have your mouth wide open, it's easy to breathe and it doesn't make a lot of noise. But if you narrow your mouth like this, you start getting a whistling sound. So for most babies, if their nose is whistling, it's just because their nasal passages are actually very small. On top of this, we have things in our nose that help protect us from debris, from dust, which is the hair, the filtering hairs, as well as mucus glands. So as you can imagine, if you've ever dusted off of a countertop and it got in your nose, the mucus glands start working, you have the hairs in there, they're catching all of that, so you're going to get some congestion. And unfortunately for babies, they don't have the ability to blow their noses and to sniff and snort like we do, so they can often sound louder than usual. Other things is that babies are something called obligate nasal breathers. What that means is babies cannot actually breathe regularly through their mouth. So that's why when they start drinking from the bottle, they often get a very stuffy nose because that congestion and mucus is moving in and out of the nose and they can't actually breathe through their mouth once the bottle has actually been removed. So you will hear a stuffier nose, and babies often actually breathe shallow and then fast, and then they'll take a big breath and then they'll breathe slowly. That's called periodic breathing of the newborn. So all that little bit of congestion and mucus that's built up in their nose when they've been breathing shallow for a minute or so and then they take a deep breath, it's very loud and turbulent, and that's also another normal cause for congested newborns. Hi. Hey, Christina. All right, something else closer to birth that can cause a baby to be stuffy is when a baby is actually born and they retain some of the amniotic fluid in their nasal passages or their lungs. For some babies, it actually can cause a little bit of breathing difficulty after birth, and then they may be watched in the nursery until it clears, but a smaller amount may just stay up in the nasal area and the sinuses, and that can last for several days, so maybe even a week or so, and that will make the baby sound more congested. It doesn't harm them, but it can be sometimes an alarm for the parent. Other common reasons is going to be spit up. So anyone that's had a baby, played with a baby, know that babies spit up all the time. There's a huge birth cloth industry because babies spit up naturally. If you think about it, a baby has an esophagus, which is the tube that goes down that they drink and eat through, and it has a sphincter at the top and a sphincter at the bottom. Well, in babies, we have this as well, but in babies, their sphincters are actually more relaxed than ours, and they open more frequently, so all that liquid in their tummy comes up very easily, especially if we lay them down. what's the best way to help them? And we're going to go over that too in just a minute when we cover the common causes. But you can see that they spit up a lot. And a lot of the times the spit up will just kind of dribble out of their mouth. They may be happy, they may be fine, but sometimes it can enter into the airway, the nasal passages, and if there's a little bit of stomach acid in there, that can actually irritate their nose. It's very sensitive in there, and that can make them more congested. And then for some babies that actually have more severe forms of spit up, which we call reflux, they have it much more and more frequently, especially when they lay down, and that can cause more inflammation. And sometimes you may have to see your doctor if that's happening, but it can cause an irritated little stuffy nose. Other common things that you can see is actually a cold. You know, we do our best to keep our infants and then the newborns away from sick children, but it happens, especially if you have toddlers at home. So with this, you will get a stuffy nose usually, but typically if it's a cold, you're going to see a runny nose as well. So if you're seeing a runny nose in a baby that's stuffy, it's more likely that they actually are sick with an upper respiratory infection or a cold. So if you see that, you probably want to speak with your doctor, but that's another very common cause. And that kind of congestion can usually last for several days to up to a week or so. Other causes, these are less common causes, can be food allergies actually. Probably the most common allergy for a baby would be a milk or a soy protein allergy. Dairy and soy kind of cross-react about 30%, so a lot of babies that have dairy allergies are going to have a soy allergy too, which is why I don't often give out soy formula. So this can be through giving formula, this can be through a mom that's breastfeeding and eating dairy products or soy products. So if you notice that you had dairy and you don't usually have it, or soy, or you were mostly breastfeeding and then you gave a formula and the baby started having issues, this may be something to talk about with your doctor. Other signs of those food allergies may be like loose stools, it could be rashes, it could be blood in the stools. There's so many different ways this can present. Again, so talk with your doctor if you think this applies to your baby. As far as other allergies, a lot of people often ask me, do you think my baby has like an allergic rhinitis, like an allergy to pollen and things in the environment? Well, babies at this age really don't have a fully developed immune system yet, so the likelihood of them having that at a younger age like this is very low. But if they do get things like dust in their nose, which they're going to be exposed to more at home, or maybe dander from pets, it will irritate the area, but you wouldn't expect them to have a full-blown reaction like we would as adults or older children. Some other less common things to think about, especially if your baby has pretty severe congestion going on, is medications. There are some medications that mom may be taking, or maybe even the baby, less likely may be taking, like beta blockers or antidepressant medications. Some of these actually can cause an increase in the dilation of the blood vessels in the nose, and this can lead to congestion. So if you're taking medications, you can ask your doctor about it, you can speak with your pediatrician, and there's actually a great website online called LactMed, where you can actually go in as a mom and put the generic name of the medications that you're taking, and it will actually tell you if it crosses the breast milk, and if it does, what are some signs you may see in the baby. So check that out. Some other things you can think of is mom's hormones. So we all have heard of baby acne, right? That's basically there because of mom's hormones. And actually this one kind of scares dads sometimes, is that the fact that baby girls when they're born can actually have vaginal discharge and periods, actually. And this is actually just due to mom's hormones, and it's completely natural. It doesn't happen very often. More often is infant acne, but you can see that. But those same hormones that pass from the mom to the baby can actually cause that same kind of swelling of the blood vessels in the nose and may cause some congestion. And typically this lasts for only a few weeks and goes away probably by the time the baby's about a month old. So these are some common things that you can see. There are some more rare conditions that I won't go into, but sometimes babies do have abnormally narrow airways, or they may actually have an underdeveloped airway, which can usually lead to pretty distressful breathing or difficulty feeding where they're not gaining weight. And certainly at that time you would want to let your doctor know or notify someone immediately. Yeah, that can happen. And if you guys have any questions, remember, go ahead and throw them in the chat. I will take a look and remind me if I don't see them. So let's get to some of the treatments, okay? So what do you want to do for this congestion? Well, the number one thing I tell basically every newborn parent that I see is, if the congestion is not bothering your baby, please don't bother it. Most of the time, you don't need to do anything at all if the baby's congested and otherwise happy and eating well and sleeping well. Just leave it alone, because usually they'll do just fine. However, if it is bothering the baby, there are a few things that you can do. So the number one thing I would say is saline. So people have definitely seen like the saline sprays or the saline drops. There's different kinds of saline. So basically, if you get some saline, you want to buy isotonic or normal saline. I think another name for it is normal or physiologic saline. So these kinds of saline can be dropped into the nose, usually like a drop or two, and it will basically loosen up the mucus that's in there, and then you can suction it out. You don't have to suction it out afterwards, but some studies have actually shown when you do the drops and then follow it with suctioning, it is actually better for the baby as far as preventing ear infections and other things that can come along with being sick. Other things that you can do would be a cool mist humidifier. You basically have your typical humidifiers that you put cool water in, not hot water, and put it close to where the baby is sleeping so that that air can kind of go in the area around the baby, because if you put it in a bigger room, it's not likely to help the baby very much. So a cool mist humidifier, saline, and bulb suction, or you can use a nose free to whatever the parent's choice is. They're all pretty effective. Other things that you can try is actually elevating the head of the bed for the baby. You don't want to put pillows or wedges and things like that in the crib to elevate the baby or the bassinet. You actually want to put a wedge or something underneath the mattress to keep them safe from things like sits. So again, wedges or something, a pillow under the mattress, but not in the bed with the baby. You can also try actually a steamy bathroom. This is for those more severe cases. So what you would do is go in the bathroom, turn your shower on hot, make it really steamy in there, close the door, and then when you're ready, go turn the shower off and go in the bathroom with the baby. Never leave the baby in there alone. Go in there and make sure that you're monitoring the baby. You can breastfeed or feed while you're in there, but this will often soften up the mucus in the nose to allow you to suction it out better afterwards. And you really don't want to stay in there for more than 15-20 minutes at the very most, or look at your baby and see how comfortable they are, and if they're not comfortable, go ahead and leave sooner. Something else that you can try for older babies that are above the age of 6 months old, would be a little bit of a warm liquid to drink. Babies under 6 months old should not receive anything except for formula or breast milk, but babies that are a little bit older can have very small amounts of other liquids like a unsweetened apple juice, or maybe even like a warm chamomile tea with no honey or anything else added, because honey is not recommended in babies less than 1. And this, if it's warm, can actually help loosen up some thick mucus in the back of the throat so that they can swallow and breathe a little bit more comfortably. Some things that you do not want to do. So parents will often ask about nasal decongestants or something called neosynephrine in babies. This is something that is not really that safe for your baby, and the reason is because babies can have an allergic reaction, but most importantly, although when it's used it can be very effective, if it's used inaccurately or for more than a couple of days, it can cause something that we call rebound congestion. And remember, we talked about the baby being an obligate nasal breather, so if they suddenly get extra congestion in their nose, they are going to have a significant time breathing, and you certainly don't want to run into that at home. So stick with your saline, stay away from medications for the nose. And as far as over-the-counter medications go in general, you don't want to give any over-the-counter cold medications to anyone under the age of 4 years old without direction from your doctor. No one likes when their baby is congested. No, they don't. As far as allergy medications, people ask me about Flonase. They ask about antihistamines, Benadryl, Zyrtec, all these different things. Typically, an infant and a newborn are not going to need anything like that. You really shouldn't be giving it to most children at all that age, especially as it's not really indicated. But if you do feel it may be indicated, talk with your doctor, and there may be some few cases where it is. But again, don't give it at home on your own. Speak with your doctor first. Let me do a quick rundown for people that are just joining in. The common causes of congestion, really quick: narrow nasal passages. There's hairs in the airway, mucus glands in the airway that make it stuffy. Babies have to breathe through their nose. They can't breathe through their mouth, so this can cause it to be difficult to clear their noses and not be congested. They may retain some of the amniotic fluid in their nose or in their lungs after birth. They may be spitting up or having reflux, which inflames the nasal mucosa, making it more stuffy. Colds, other upper respiratory infections, food allergies to things like dairy and soy, medications that mom may be taking, as well as her hormones that typically should wear off after a few weeks. A couple last things that you do not want to do to help your baby that's congested is vapor rubs. Vapor rubs are not recommended for babies under 2 years old. Those are the ones that have the menthol, the camphor in them. People will put it in the humidifier sometimes on the feet, on the baby. Don't do it. For your infants and newborns, you don't want to do that. Just go ahead and stick with the things that we talked about, because you can sometimes see adverse reactions with these products, okay? And then lastly, with suctioning, it can be very helpful if you do it a few times a day, maybe 2-3 times a day, but don't overdo it, because again, that mucosa in the nose is very sensitive, so you can irritate it by suctioning too much, or you can just irritate the outside of the nose. So what I recommend is do it about 3 times a day, and then actually a little tip is take some Vaseline or Aquaphor and put it right at the entrance of the nares, so that when you're putting the bulb there, you're not rubbing and irritating the baby's nose. A couple other quick tips. If your baby's having a hard time with eating, suction before feeding, giving a bottle, get the bottle ready or get ready to breastfeed, suction right before with the saline and then latch or give the bottle, and then suction before sleeping. Do not suction after eating, otherwise you're going to have a mess of vomit everywhere, so avoid that. And then also for babies that are very stuffy, maybe with a cold or something, feed smaller feeds more frequently. So if you typically give your baby about 4 ounces every 4 hours, do 2 ounces every 2 hours. They'll still be getting the same amount, but they won't have such a hard time with eating. And then lastly, if your baby is having difficulty breathing, difficulty sleeping, difficulty feeding overall, don't assume that it's normal. Don't assume that Dr. Andrea said that it could be this, that must be what it is. If your baby is struggling at all, always call your doctor and get their advice. Hi Nicole. Hi Becky. Congratulations, I believe is in order. I think you just had a little one if I saw correctly. So does anyone have any questions? I hope that was helpful. I hope that you guys can share this video and that it covers some questions that you may have had. Tell the boys I said hi, Nicole, from Dr. Auntie Angie. All right, if not, thank you guys for tuning in. You can always follow me at Dr. Andrea MD on most social media and my Facebook page. That's DrAndreaMD. Let me know if you have any questions. Share this video, and I look forward to talking with you guys more. I'm going to be covering some more health topics and actually a little bit of baby sign language, most likely every Monday morning around 10 a.m. So join me then, and otherwise shoot me a message if you have any other questions. Have a great evening, guys. Bye-bye.